Today we are here with Reverend Najuma for our learning collaborative on building a stronger bridge between faith communities and behavioral health crisis care agencies. And this is session 4, collaboration and program development and funding opportunities.
Good morning, everyone, and thank you for joining us on part 4 of our learning collaborative. It has been an honor representing my organization, the Center for Religion and Civic Culture, the Cecil Murray Center, the work that I do there and in the city in and around Los Angeles, working with faith communities, continuing to build bridges with organizations like CARE and others throughout LA County and even other parts of Southern California. So the first 3 sessions, just by way of a quick review. First, we talked about natural disasters. We were coming out of or in the thick of, if you will, the COVID-19 pandemic. And so our first session was all about working with faith communities and mental health crisis care, behavioral health agencies, and in getting mental health care and needs and assessments. How do we start this conversation? How do we begin to build that bridge? Seeing how our nation has been so impacted by the pandemic, and both when we talk about mental health, behavioral health agencies, workers often are on the front line side by side with faith leaders who are often first responders in things like this. So that was kind of our first session. Then the second session, we talked about the continuum of crisis care as it relates to building those bridges, faith leaders, lay leaders, behavioral resources. Where do we find and collaborate on building resources together? Our third session, we focused on particularly we focused around, hi Coach Ron, we focused around this issue on suicide, but also community-based suicide prevention, overdose prevention, how to avoid unnecessary hospitalization and incarceration around these issues, as we've seen an uptick in these areas following the pandemic. And we're still in the pandemic, so it's kind of hard. I'm tempted to say post-pandemic, but we're not really post-pandemic. And we do see those numbers going back up. And so it's great that we have now built this bridge. And some of you may have connected with others in previous sessions, but also we now have additional tools in our toolkit, both faith leaders as well as our behavioral health care workers. And so that was just a kind of quick overview of the first 3 sessions. Now also be reminded, you should have received an email that had a recording for these 3 sessions, and you will get another email after this session, which will give you more access to recording. So you should be able to catch all 4 sessions if you missed anything. So today we're going to the next level, and we're going to be talking about collaborating and cross-funding, how to really take what we have been talking about, building the bridge, but then how do we make this work sustainable? How do we move into programming? How do we move into funding and really putting some legs beneath the bridge that we're building? So our learning objectives: to learn about success and challenges of faith and secular emergency and crisis response grant writing and programming, gain awareness of new funding opportunities, and consider areas of common themes and goals where joint funding, proposal, and programming might be helpful. And then our homework, as it has been with our past 3 sessions, again, I want to encourage you, and I'm going to say it again, review the last 3 sessions plus this one. Follow up, use the SMART framework it's a tool that will be shared in the chat, a link there, and continue to build the bridge between behavioral health care workers and faith leaders. Make sure that we are making contacts with people in these fields. So our goals for today are kind of just two key goals today. The first is we will look at issues and barriers to creating sustainable joint programming between our faith and behavioral health departments, agencies. We'll look at a couple of case studies of success, and then we'll review the landscape of opportunities where faith and behavioral health workers, care workers can collaborate, themes and common issues, and potential funding. So I believe this session will help us take things to the next level. Okay, so our overall big idea, and I want to encourage everyone, if not, write this down or screenshot this particular slide, which is our big idea. We had one main goal or big idea over the past 4 sessions, and that was to recognize that faith communities are embedded assets, and part of the efficacy in reaching the community is in working with faith communities. So if we're going to be effective in reaching community, part of the efficacy of that is reaching to faith communities and vice versa. Faith communities also building bridges with our behavioral health care workers, especially realizing coming through a pandemic, the weight in which we have experienced so much on our emotional and mental health. And so this is the big idea. And I hope that this idea has really been ingrained, especially for those of you who have come to all 4 sessions. This is your 4th session, or at least 2 or 3. You've seen this slide at each and every session. And I really hope this, if you take nothing else away, take this one away and allow that to guide the work that you'll do in communities. So again, our session today will kind of be in 3 parts. We'll ID leading challenges and strategies for success. We'll look at a few case studies, and then we'll talk about sustainability and funding. So our first connection is how to have successful collaboration. Our entire premise in these 4 sessions, as we saw in the big idea, was about working with faith communities to identify opportunities for building bridges and collaboration. In order to do this, we're going to have a conversation about common challenges and how we overcome them. Because even though ideally we want to build this very firm bridge, we're also very clear that there are challenges. And for those that are just coming in, please put in the chat where you are calling or joining in from, name of your organization that you're representing. We just like to know and connect, and feel free to put questions or comments in the chat. So success cannot be assumed, it must be planned. That's one of my quotes in these previous sessions that I've done. That's a picture of me teaching an Indonesian, they were all these individuals from Indonesia, and they came to do a similar kind of program as relates to working with faith communities and agencies, and to build bridges and do some collaborative work. And so it was great. We were blessed to be able to host them at our office, these leaders here. So success cannot be assumed, it must be planned. And the reason it must be planned is because we have some definite challenges or barriers that we have to overcome. And so the 3 leading barriers in the work that we've done and the work that we can, and I do, 3 barriers, and there's a host of other barriers. So feel free if something else comes up for you, some other barriers or challenges, put those in the chat and let's talk about them. But we've kind of grouped them in these 3 areas: trust factors, transparency, and training, right? That part of the challenges we must overcome, and sometimes even the barriers, the trust factor, transparency, and training. And what we recognize is that when you work with faith communities and agencies that are not used to being in the same space together, and this bridge is still new, there's often trust factor. And I know within faith communities, because faith communities, there is a history where faith communities have historically been sometimes misused, exploited, if you will, to get to communities. And so sometimes faith leaders are hesitant. That's a reality. And so when you're talking about working with faith communities to build collaborations, to do some grant funding, there's often a little bit of air or skepticism that has to be addressed. But knowing that as a behavioral health worker or agency, knowing that, then what we have to do is plan around that. We have to build that bridge with the understanding and the clarity that there may be trust factors, because again, faith communities have been, exploited, misused, with, with for an agenda. And so there is a trust factor. The other challenge that we find when we work with faith communities is sometimes there's a transparency issue. And what I mean by that is, much like the trust factor, you have faith communities that are hesitant to be just fully transparent up front, fully open. Oh, here's our books, here's what we do, come on in. Because spiritual leaders, faith leaders have to be cautious over their community, over their congregation, over their organization, over their worship space. And so there's not this immediate openness, but sometimes there's a hesitancy to be transparent. And so that is also a challenge that has to be contended with. And then oftentimes training. One of the things that I shared recently with another organization I was working with was we have to be mindful that faith communities are made up of people who may or may not necessarily have training in particular skill sets. Doesn't mean they don't have any, but they may not have particular training and skill sets as relates to this work of collaboration, program development, sustainability, et cetera, et cetera. And so sometimes we have to come in offering training or recognizing that training is not always that every congregation in every community, even though they have a desire to do good works, they may not necessarily have a skill set. So these are some challenges that we have recognized. And again, feel free to put in the chat if you notice any other, if you can name any other challenges that have come up for you in this work of working with faith communities and faith communities working with behavioral health departments and agencies, is trust factors, transparency, and training. So what we've also found ways in which to overcome these three leading challenges is empowerment, right? Doing some co-training. As a behavioral health agency, maybe coming in and offering a training in a particular area that the faith community may not have training in. So when we talked about last time we were together, we talked about suicide prevention, postvention. A lot of faith communities don't know really what that prevention looks like. Where a behavioral health agency would have an opportunity is to offer training to that community. The other aspect or another way to overcome challenge this, one of the challenges to relationship building beyond introduction, but really leading to mutual interest. And we're going to talk about that a little bit more, because it is often assumed that faith communities, because they are a community of faith and they at their core want to do good, that they're welcoming to every agency, every department, every organization to come on in, let's do good work. What I offer to our behavioral health care workers and agencies, and even to our faith leaders and faith-based organizations and non-faith-based organizations, is to really move beyond the relationship building, beyond just introduction. We both want to do good work, let's partner together, but talk about mutual interest. And I want to stay here for a minute. What we have found to be the most effective thing is when you have two organizations coming together, and let's take a faith community and a behavioral health agency, and that relationship being developed in such a way that both organizations or both teams or both individuals, however you want to put it, figure out what's our mutual interest. What's our mutual interest beyond doing good? If we're talking about the issue of the pandemic, what's our mutual interest? Because it may not necessarily be vaccines. I don't know. I'm just throwing some stuff out there, but really digging down deep in this relationship building and figuring out, finding out, and getting clear on what's our mutual interest. Yes, in general, we all want to do good, but what do we have a mutual interest in as it relates to this issue regarding mental health care, crises care, et cetera, et cetera. And I hope that you'll make a note of that if you're taking notes, or put it in the chat, mutual interest. What's our mutual, we're talking again about building collaboration, and collaboration is bigger than just introduction and say we both want to do good works. It's really about discovering and honing down what our mutual interest is. And again, When we talk about transparency and trust building, it's all in this relationship building piece, right? All goes together. And then our last factor that we've discovered as it relates to overcoming these challenges is prioritizing mutual benefit, right? So mutual interest and mutual benefit are not the same. Mutual interest is we both have an interest in seeing COVID cases come down. Mutual benefit is, and how does that benefit the healthcare behavioral health organization? And how does that work benefit the faith community or organization? And those two may be mutually, may not be the same. The core, the priority is let's figure out, let's work towards a mutual benefit. How do we both benefit, even if we benefit differently, right? But they're not necessarily the same. For the organization, the benefit might be, being able to account for reaching a certain number of people. The benefit for the faith community might be making sure all of the seniors are vaccinated and all the babies are vaccinated, right? So the benefit and the interests are not always the same in definition for each organization, but they're not all the same the same priority. So we really want to work on that. When we talk about overcoming the challenge of trust, transparency, and training, is really getting down to mutual interest and mutual benefit. And feel free to ask any questions in the chat. Additional sustainability challenges, and we're going to get to some good stuff in a minute, but I want to talk about the challenges and let's confront those up front. When we talk about collaboration building and funding, is sometimes the lack of decision, knowledge, the lack of previous experience with collaboration, lack of commitment, lack of faith even, and lack of capacity. So there's just some additional challenges that you might run into when you're trying to do this work in building collaboration and seeking funding, right? So again, success is not assumed, it's planned. Knowing these factors and identifying them as they come up, or even as you are attempting to plan around or plan to run into some of these challenges, but then how do we plan around them? How do we plan to overcome them? Because it's great to assume this will be easy peasy, but I guarantee you one, if not more, of these issues or challenges will come up. If it's not the first three, it'll probably be one of these six and maybe even a couple of them. But we don't want to just assume success. We want to plan for success. So here's a couple of case studies where we've actually done some collaboration in addition to funding. So one area is our church was able to collaborate with Creating Beautiful Minds, which is a mental health company or agency. And so we were able to secure funding to do a 6-part series and then some additional training, so a 6-part series on dealing with grief and loss during the pandemic. Additionally, we did some training on domestic violence, because one of the things that we saw an uptick in was domestic violence here in Los Angeles County. In addition, I'm sure across the nation, there was an uptick. And so we were able to secure funding through one of the local universities, Pepperdine University. And because we were still in the social distancing space more than anything else, all of these sessions were done virtually. So that was a successful model. And our mutual interest was in working with, the violence issue as well as the grief issue. The mutual benefit was this smaller organization was able to continue their work, and our church, we became a resource for a number of people who were dealing with grief and loss because they had lost loved ones and family members during the pandemic, even prior to that, but also being able to offer a training in the area of domestic violence and resources. Another case study or another success story was Project Heal, which was an initiative and a partnership between the Children's Los Angeles Hospital, the Murray Center, and New Mount Calvary Baptist Church. This was an embedded process. Project HEAL was actually embedded at New Mount Calvary Baptist Church. And it was over a year where they were there doing research, but also finding out, this was pre-pandemic, finding out what communities needed in that particular area of Los Angeles. So they did some in-depth surveys, research, but also they were also, because they were embedded, they were also able to offer services and programming to the church, but also the local community. And this was, again, a collaboration between 3 organizations. And so the mutual interest was around finding out what that community deeply needed and how Children's Hospital of Los Angeles could be a part of that, so, providing those needs, doing an assessment, and then providing the need, the greatest need, but also our organization, as well as New Mount Calvary Baptist, were able to be a part of that project that was embedded at New Mount Calvary Baptist Church. And the church, of course, saw benefit in that they were able to be a service provider hub during this year for their community, right? So mutual interest, mutual benefit. And then the last one was our collaboration with the California Endowment in their healthy communities, where we actually were able to strengthen several faith communities in and around Los Angeles County over, I believe it was a 10-year period, where we were part of their healthy communities programming. Again, mutual interest, mutual benefit. And the mutual benefit for our organization was being able to strengthen healthy congregations, that they would be healthy and strong in these communities where they were embedded. The benefit, of course, for California Endowment is it met their interest in helping to uplift certain communities. They had identified 14 communities in Southern California, of which we were able to, or in California, of which we were able to participate in that. Mutual interest, mutual benefit. And the thing about collaboration, when we think about working with faith communities, as well as faith communities working with healthcare agencies, is that we don't have to recreate the wheel. Someone has already done the work. So what we want to encourage is using models, looking at models that have worked in the past and expounding on innovative ideas and practices. This is why we lift up case studies, but there are a plethora of case studies, and maybe some of you might have some ideas of previous case studies, so feel free to put that in the chat. But again, these were all collaborations based upon funding opportunities. And so the first model was something very small scale. The second one was medium scale, and it was it entailed 3 different agencies or departments: the church, the hospital, and the community center, the Murray Center. And then the second one was more partnership, not directly with the faith community, but the faith community was an indirect partner and also beneficiary. So there's a few ways we think about doing this work that it can be done, right? So it's not just one way. We have 3 different models, 3 different size scales, 3 different kinds of budgets. And so there's several ways that you all can do this work when we talk about collaborating and funding, okay? And these were all funded, fully funded projects and programs. So let's think through some themes and funding opportunities. What I want to introduce here, and we're talking about developing a collaboration, and I want to encourage everyone to screenshot this, collaborating for funding. I want to encourage everyone to do this piece first, right? To do this piece first. Oftentimes we have great ideas, and this is both for our healthcare agencies, our behavioral health care agencies, and our faith communities. Oftentimes we have great ideas. Let's partner together. Let's write a grant. Let's do this, right? But there actually is a process, and this model, this logic model works. We use it all the time, and I want to encourage everyone, write it down, screenshot it. When you get the copy of the slides, put this on your wall when you're thinking through how to partner, collaborate with behavioral health agencies, crisis care workers, faith communities, and vice versa. It's called the logic model. Some of you may be familiar with this. If you're not, again, screenshot, write it down, take a picture. And then when you get the slides for yourself, pull this slide out, put up on your wall. So the first step is to identify what the problem is. And again, you'll do this in collaboration with the organization you're working with, whether it's faith community, behavioral health care agency, vice versa, is really identify what's the problem. What is the problem? And the symptom and the problem are not always the same. I'll say that again. The symptom and the problem are not always the same. And sometimes we're trying to address symptoms and we're not addressing problem. Somebody put that in the chat for me. Symptom and problems are not the same. And sometimes we address symptoms, but we're not addressing the real problem. And I want to encourage everyone, spend a good amount of time fleshing out the problem. And all of this is about collaborating and funding. And we can miss opportunities to collaborate well and get funding if we're not clear about the problem and that we're not addressing symptoms, but addressing problems. And then the next step is, what's the goal? We've identified our problem. Now, what's the goal in identifying this problem? So, and we're going to go to the goal. And then we work through what are the resources already available. Again, we said previously, we don't need to invent the wheel. There may be sources and resources. This is all about collaborating. How do we collaborate looking at resources that may already be available? So we're not reinventing the wheel. Okay, thank you, Ty. So drug plagues community cause is mental health, mental illness. Okay, so you're saying the problem is mental illness that leads to drug abuse or drug use. The problem you're saying is drug use and drug abuse.
Yes.
Right. But and most of us are clear that drug use and abuse is a response to a deeper problem. Oftentimes.
Is it a response?
Right. Usually drug use and abuse is a response or reaction to a deeper problem. Right. So this is where we would say, again, I'm not suggesting that we don't address drugs, but if we're talking about collaborating on solving a problem, if we take people off drugs, but we don't solve their problem. And that's why I want to encourage, we're talking about collaborating. What's the problem we want to really address? Not to say drug abuse and prevention won't be a part of the programming, won't be a part of the goal, but also what's the problem? So in identifying the problem, now we have to really work through collaborating together, faith community and crisis care worker. What's the goal? Is the goal just to get our young people off drugs, which I'm not opposed to, or do we actually want to deal with the deeper issue? Why are so many young people taking Percocet, lean, and all these other things? Why are so many people literally mixing Kool-Aid and cough medicine and drinking it like it's water, right? What's the goal? And then looking at what resources are already available. We don't have to reinvent the wheel, but part of our collaborative effort is to figure out what resources are available within behavioral health care agencies, departments, maybe outside of that, what resources are available within the faith communities, what are the resources, and really working through listing that out. And then based upon that, deciding what are our activities going to be? What are our activities going to be? What are we going to do together? And then maybe even what do we need to do separate? What's the pastor going to do? And what's the behavioral health care center or agency going to do? And then what are we going to do together, right? And then what are the outputs? What are the things that we're going to put out? Outputs and outcomes are different, right? So what's the output? Do we want to put out printing material? Do we want to open up testing sites? What do we want to put out, right? What do we want to put out? And then once we've done all that, what do we hope the outcome will be? And the outcomes, and you see that arrow going back there, should address our goals, right? So that's the logic model. And then at the end, when we talk about evaluation, that last part, our rationale and our assumptions was our rationale and our assumptions correct? When we said in the problem statement, your outputs depend on your audience. Absolutely, Stadies. But this is why collaboratively we worked that out together. What's our output? So for the faith community might need one thing, and the behavioral health care agency might need something different, and we might need some things together. But this is why we work the logic model together when we're talking about collaborating and funding, right? This is part of that process. This is why just going off a good idea is not enough. We got to really work together in doing this process. And I promise you, if you work this together, if you work this logic model, you will win. You will win. You will win. If you work this process, you will win. And then all of that should equal or at least align with your rationale and your assumptions. It may not be perfect, but it should even out when you do your evaluation. And so this is why we encourage the logic model, especially when we're talking about collaborating and seeking funding. And there are other models, there are other ways to do this work, but this is one that we've seen work time and time again, especially when we're talking about collaborating and working this piece out together so we can win together. So planning is always a process, and it's rarely linear. As we make strategic decisions based upon evaluation findings, we might you move right back into the planning stages, right? So this is an ongoing cycle. And really, why I added this here is because talking about the work that we're talking about doing on this relationship building, collaborating, funding, we're not out here trying to do one and dones. We're out here trying to doing a process that benefits our communities, but also meets the mutual interest and mutual benefit of our faith community leaders and faith communities, as well as our behavioral health care agencies and departments. And so once you've planned, once you've collected your data, done your analysis, you create your action improvement, and we're constantly on this circle of learning and doing this work together, right? And so this is just another example of how to go through the process of planning, collecting data, analyzing, reflecting on what we've done, what's our next action, how do we improve, and going back and doing it all over again, especially if we're talking about ongoing relationship building, ongoing collaboration. Once you've actually done one thing, then you go right back to planning, data collection, reflect, analyze, action, improvement, and then we go to the next thing. So we're on this continuous cycle in community with each other on this bridge, constantly strengthening the bridge, constantly working together. So what's the meaning of process? And we all know this, but I'm just quick review. Systematic series of actions directed to some end, to devise a process of mental health awareness engagement. So I just said, for example, we want to devise a process of mental health awareness engagement. That's the point of us moving this process together, right? Is that we have not a one and done, absolutely, Stacey, that we have a process of mental health awareness engagement together. This is why we've encouraged on all 4 sessions, faith leaders connect with our behavioral health care workers. Behavioral health care workers collaborate and build with our faith communities. So we are devising a process where mental health awareness engagement is ongoing. And what's the difference between a process and event? A process is a series of progressive and interdependent steps by which an end is obtained. In essence, planning is a process, not an event. Again, we're not interested in one-time, one and done events. We wanted this to be a series of progressive and interdependent steps to an end, to which an end is obtained. And that end, again, is mental health awareness, engagement, mental health wellness, building stronger communities with stronger mental health, all those things, right? And it could be very niche, where we're talking about, to your point, Ty and Alicia, the mental health of our youth and our young people. So the move away from the use of drugs and abuse, et cetera, et cetera, et cetera. So we can go on and on with this for days, really niching it down to what it is we want to get done. So grants versus contracts. So now we're going to move into talking a little bit about the funding process. And for some of you, this may be new information. For others, it might be review. But this is what we typically take our cohorts through when we talk about fundraising, funding, collaborating, that there is a difference between grants and contracts. Grants usually comes from a funder where they have an interest, and you are granted a particular pot of finance. A contract is when you're brought in to do a particular assignment, and it has, both of them typically have a deadline. Grants can sometimes be open-ended. So you have some grants that the funder has a particular interest in, and they want a particular outcome. And so you have to do a report, and you have to fulfill a list of what they call deliverables. Whereas a contract, you might be contracted as a faith community for a particular assignment or particular job, and then that's the end of the contract. So that's a slight difference. A contract is you're brought in or used to do a particular work. Grant is you're given the funding to do the particular work, and then you run the program or the project yourself. So you might have an agency that has a grant, and the agency or the behavioral health agency might contract with the faith community. So you might have that kind of collaboration, or you may have a faith community along with a behavioral health agency where they collaborate on a project where they receive a grant, or you might the behavioral health agency and the faith community might both be contracted to do a particular work. So those are different ways that those things can happen. And again, it's all about figuring out mutual interest, mutual benefit, what works for both, right? We want to encourage researching private sector donors. Sometimes, we tend to just go after one particular sector, but we have foundations, you have corporations, and you have wealthy donors. So somebody give me an example of a foundation, somebody put in the chat an example of a corporation, and maybe somebody put in the chat an example of a wealthy donor. Who might a foundation be that you could collaborate with that your collaboration might seek to do work with or seek a grant with? What's a particular foundation? I think I named one, but maybe you might have another. So put one foundation, put a corporation. What's a corporation? And then maybe a wealthy donor. And feel free to put that in the chat. And then you also have government RFPs, right? So government departments, Homeland Security, Department of Transportation, Department of Justice. Then you have state, county, and the city. So these are government requests for proposal where the government is seeking to work with the community. And again, this is a great opportunity for a behavioral health agency, community first investment, government. Thank you, Ty. Feel free to put in the chat a foundation, a corporation, wealthy donor. Thank you, Ty, for your thoughts. And let me say this about foundations and corporations, and maybe somebody put in the chat a wealthy donor. When we talk about research government RFPs, this is also an opportunity for faith communities as it relates to working with behavioral health agencies. Government RFPs are a great opportunity for faith communities to work with and collaborate with our behavioral health agencies, because oftentimes faith communities do not have the capacity to do a government RFP on their own. So to my faith community leaders, working with behavioral health agencies and departments is a great opportunity to tap into government RFPs, because a lot of times our faith communities while we may have the community, while we may have the access to the research that's needed, we don't have capacity to actually fulfill the request for proposal. So this is we're talking about government, it's a great opportunity for collaboration. And then a lot of times our elected and civic employees, they have budgets and they have opportunities for grant opportunities. I know the mayor, Mayor Garcetti, for those of us that are in Los Angeles, I know he has a budget and he's able to do some things. And then even our local electeds, you're here in LA, I'm not sure, some of you may be outside of Los Angeles, but I know for sure here in Los Angeles, we have our district councils that also have budgets where they can do some grant work with them as well. So these are just some opportunities for those that are unfamiliar. So again, back to grants versus contracts for service. And then these are just some things to be aware of when you're talking about pursuing a grant. And I'll just read through it real quick. Grants that can be anywhere from 3 to 6 months to fund. So that's the time frame it takes, sometimes longer, depending on what is needed to prepare. Rarely is the amount large to begin. So your first time getting a grant, it might be a starter grant, but then you can build from there, especially if you're talking about a recurring grant opportunity. We're talking about working with faith communities or community-based organizations. It's 1 to 3 years, sometimes 5, sometimes longer, or they're recurring grants. Limited to 25% of the annual budget. So they will only, whatever your total budget is for the program or project you're doing, sometimes the grant is only about 25% of that. But again, that depends. They can also be fully funded grants. And then you have some that are place-based, meaning LA, some might be race-based. We're talking about African-American young people or, African-American youth or our AAPI community. And then sometimes it's broader than that. And sometimes it's be more niche than that. And then your outcomes, they're looking for outputs, outcomes, and social impact. Oftentimes funders, and we saw the different kinds of funders are looking for outputs, outcomes, and social impact. So you have to be very clear in understanding what's being sought after. And then your program officer moves on to the next thing. So just be aware of these are some of the things when you talk about grants versus contracts for service. And contracts are very different. That's when you're paid to a particular work for a particular time frame, and then that's it. And again, here are some places that are looking for data. So when we talk about collaborating, these are also opportunities to do grant work with, to seek funding, because these are also departments that are looking for data, looking for research, looking for information, that a collaboration between a behavioral health agency and a faith community can provide and offer, or you may receive funding to do data collection, funding to research, funding to run a program, and then running that program, you have data to offer back. So we have our elected and we have civic offices. And again, these are just funding opportunities. So I want to challenge you to think through who could benefit from working with a behavioral health agency or working with a faith community. And we want to work with our young people in solving the problem around the use of drugs, right? But who might also benefit or have interest in knowing what we discovered when we did this program with youth in South LA around drug use. And here are our findings. Our federal agency might have an interest, our state, our city, et cetera, et cetera. So these are, again, different. We're challenging you to think through the process of planning and who would have an interest and where might there be opportunity for grants, funding, collaborations, et cetera, et cetera. And what will separate the work that we do from others is our ability to research. Facts find funds. Put that in the chat. Facts find funds. Funds make ministry work. So when we're able to offer facts, research, and it could just be in working with our behavioral health agency, we discovered that in a particular neighborhood, we saw an X amount of number of mental health cases or issues in this area. That fact can lead to funds, and those funds can lead to greater opportunity for ministry work. And when I say ministry work, I'm also talking about resources resources in our behavioral health communities, agencies that can also work through the church, through the ministry, through the faith community, that could be a benefit to the broader community, right? So again, working together, facts find funds and funds make ministry work. Absolutely. Thank you, Danielle. So be very, and this is why we say, I'm going to go back to the very first point of this whole thing. Faith communities are embedded assets because sometimes our faith communities have access to facts that can lead to funding, right? Because we know our community. And so working together to research. Right now, even our department has been brought in. We're going to be working with communities in Long Beach, faith communities in Long Beach, on a project, an EPIC project. We've been funded to do a certain level of research with the faith communities in Long Beach, California. So again, facts find funds, right? So just remember that. What wasn't on the other slide was stakeholders and referrals. And let me say this real quick to our behavioral health agencies and care workers. I know you see their HUD, Commerce, EPA, Transportation. Be very clear, and I'm sure most of you know this, but if you don't know this, I hope you know this today, that even if it's coming from the Department of Transportation or Metro, there may still be, when we talk about going through that logic model, the programming or the collaborative work that you do with the faith community could very well could be of mutual benefit to the Department of Transportation or here in LA, Metro. So don't think, well, we're behavioral health, that's transportation. The two are exclusive, not necessarily. Not when you have issues, when you have Metro that talks about who has recorded issues where we're having people on our transportation, public transportation, who are experiencing mental health challenges on the bus, on rail, right? And so there could be opportunity. And remember, we said earlier about being innovative. There could be opportunity to offer to Metro some facts that could help them deliver transportation safety better based upon the information and the facts that you have found with faith communities around mental health awareness, mental health engagement, et cetera, et cetera. And so don't look at a particular department and think, oh, that's totally, there's no opportunity. We are a melting pot. We all work together. Everything works together. And so even though you see HUD and Commerce, EPA and Transportation up there, do not think that your facts cannot be useful in funding in these other areas. And I just wanted to put that out there. And that's why we talked about in the previous slide that we don't have to necessarily reinvent the wheel, but we can elaborate and expand with innovation, process and planning on things, on models that have already worked before. So I just want to put that out there to our behavioral health workers and agencies, that even departments and funding sources that are not explicitly aligned, through innovative process planning, there could be opportunity for alignment. So here are some organizational and technical assistance providers as we are thinking about and thinking through building this bridge. Again, you'll get this slide. These are just some that we have used in the past. and we share out with folks that we've worked with in the past, but you'll get this slide so you can check. Some of you may be familiar with these already, but if you're not, here are just some technical assistance as you're building the collaboration, working through the process and planning. Put in, I used to think or believe, now I think or believe, or now I know. Yeah, good ideas are great, but they don't take us very far if we're not working together and really planning to win, planning to be successful. And I used to think and believe that as a leader, you have to self-sacrifice now.
Thank you so much, Reverend Najuma. That was amazing. Thank you to everyone who's here. We look forward to continuing to work with you. Please stay in touch. Our information is up for you if you need it. And we look forward to seeing you again.